As more and more people get vaccinated against COVID-19, new layers of questions are now unfolding. That's especially true when it comes to caretakers and your children.
WPTV News Channel 5's Tori Dunnan sharing what you need to know to keep you and your kids safe.
Once it becomes more readily available, we certainly want to protect all of those people around our children.
Pediatrician Dr. Chad Rudnick says many parents are now pondering childcare questions as COVID-19 vaccinations ramp up.
It should be something that's talked about. We want to protect everyone who's unable to be vaccinated.
He recommends parents consider making sure close contacts who come into their home are vaccinated.
Babies and young children who've had nannies or other caretakers or even family members who care for them in the home is to consider having those family members vaccinated against things like the flu and making sure they've had an updated whooping cough vaccine. So that's always been a part of the recommendation, and it should be no different with the COVID vaccine.
Ultimately, it's a family choice.
I think that's something for each family to have to decide.
Nicole Anderson, CEO of Mend HR Solutions in West Palm Beach, says this topic is something she's coaching on.
Someone coming into your house, if you're paying them, you're paying them taxes, you have them employed as a W-2 employee, then you can require it. I always recommend strongly recommending the vaccine instead of requiring it.
She says listen to your employees' concerns and be ready to make a decision.
If you know that you want somebody that's vaccinated and this person is not going to get vaccinated, know what you're going to do.
She says understand there may be a health condition that would prevent the employee from getting the vaccine. One option she suggests is providing a reasonable accommodation like temperature checks at the door and handing out masks.
Having them report if they've been in contact with anybody with COVID.
A casual babysitter, she says, would fall under a different category.
If you're just paying them $20 to come babysit, I mean, you have a little bit more leeway to say, I'm sorry, you're not vaccinated, you're not babysitting.
Both Dr. Rudnick and Anderson say this is just the beginning of considerations to come.
I think this brings up kind of that next layer of questions where parents are going to be able to ask, okay, is my child's teacher next year going to be vaccinated, or is my child's camp counselor going to be vaccinated? It's a question that parents should be allowed to ask.
Tori Dunnan, WPTV News Channel 5.